So I'm here in Asia with Dr. Michael Ellenberg from all the way from Alaska.
Or from Alaska.
A little different temperature here
Yeah.
in Bangkok at the ISLA Laser Therapy Conference. Dr. Ellenberg, great to see you.
Good to be here.
We're looking forward to seeing you in San Diego in a few months' time at the ISLA conference there. You're using laser therapy quite considerably in your clinic, so can you tell me a little bit about that, how long you've been using it, and what different modalities you've been treating?
Certainly.
And the success rate so far?
Yeah, no problem. I started using a Weber medical system about 2.5 years ago, and we've treated around 1,000 patients in that time. And in my practice in Anchorage, we see a lot of people with chronic conditions, such as infections is a big one, so Epstein-Barr virus. We see a lot more Lyme disease these days as well, and Alaskans that are from somewhere else originally. We also treat a lot of cardiovascular disease patients, and then we also work a lot with cancer. And we've seen some really good success in even the combination of therapies. I use a lot of ozone therapy in my practice as well, and I really like the combination of it. And the laser blood irradiation or intravenous laser blood irradiation is a fascinating science. Hardly known to anybody in the U.S. for a very long time. The Russians invented it over 30 years ago. And there's different types of wavelengths that can be used, from red to yellow, green, blue, ultraviolet, and you can treat a myriad of conditions. And the mechanisms, which is kind of my part I really like, and that's what I talk about, I'll be talking about in San Diego, is how does this type of science actually work? Now, there's a lot we don't know, but what we do know, we can start elaborating on and educating providers, because it's a very powerful system. It's a safe system. It's low side effects. It's easy to implement into a patient, and it also goes in quite well with other IV therapies if doctors are using that in those practices as well.
Now, you were telling me that you've been involved in laser therapy in your area over several years, and then you got to know what was going on with the Webers, in particular Dr. Michael Weber, over several years, and it hadn't really got to America at that stage. This is just going to be their second conference in America. How are you finding the development that Michael Weber is bringing out here compared to what you've seen previously in the US market as far as laser therapy?
Well, in the US market, there's one other company called UVRLX, and it's a lower power system, but it can be effective at times. And what this offers here is we have many applications. So besides IV therapies, you can also use it topically for different conditions. You can also use it intra-articular. So if you're doing PRP type therapies, you can actually enhance them. And there are studies that have demonstrated that if you, after doing PRP on a patient, say their knee, for example, and you do the laser behind it, you can actually get a better treatment result for patients. I used to work a lot for a long time with ultraviolet blood irradiation, for many years. And when I came across this system and this type of science, it's a much more encompassing, and you can treat more of the blood supply, the entire blood supply for that matter, and get far different treatment effects. And I've used lasers as far back as 18 years ago, but that was using mostly topical applications, and wasn't really aware of intravenous until about 2 years ago.
There's obviously different conditions that the different colored lasers are treating. What's exciting you most? Is it the chronic infectious disease and the results they're getting? Obviously, regenerative medicine is a key player with the laser therapy.
Absolutely.
But some of the innovations that seem to be now that they're achieving, particularly in chronic infectious disease, that seems pretty exciting.
Well, it's very exciting, and you can use different agents with the laser system to help you actually make the blood more photosensitive. So IV curcumin, for example, poly-MBA can be used, and it can make that more effective. And what I've been very, very surprised about, and in a very happy way, is that neurological conditions such as Alzheimer's and dementia, depression and PTSD, because this actually can help people's brains. So even traumatic brain injuries. So we've had a few patients in our practice in the last few months that have had some serious changes with doing intravenous therapy for their brain health, which it's hard to have that effect with the patient.
All this is going to come out in a few months' time. It's the ISLA conference in San Diego, February the 1st to the 3rd. You're going to be joining them there, Dr. Ellenberg, with several other eminent doctors from around the globe, all using this technology at a different pace in different areas. So we look forward to seeing you. We thank you for your time, and safe traveling back to Alaska.
All right, thank you.